Assalamu alaikum wa rahmatullahi wa barakatuh. A'udhu billahi minash shaitanir rajim. We seek refuge in Allah from the accursed shaitan. Bismillahir rahmanir rahim. In the name of Allah, most merciful, especially merciful. Subhanaka, glory be to you, O Allah. La ilma lana, there is no knowledge for us. Illa ma alamtana, except that which you teach us. Allahumma alimna ma yanfa'una. O Allah, teach us that which will be beneficial for us. Wazidna ilma, and increase us in knowledge. وَارْزُقْنَا فَهْمًا, and grant us understanding. يَا مُقَلِّبَ الْقُلُوبِ, O change of hearts. ثَبِّتْ قُلُوبَنَا عَلَى دِينِكَ, keep our hearts firm on your deen. اللهم اجعل أعمالنا خالصة لوجهك. O Allah, grant our actions to be done sincerely for your sake. ولا تجعل فيها حظ لغيرك, and let there not be in them a portion for other than you. Ameen ya Rabbil Alameen. Welcome to today's session on overview of mental illness called Mind the Gap by Dr. Feroza Arbee. This is hosted by Muslims Connected, which is an online institution and organization. We have Arabic classes that are running and also have one-on-one Quran classes for those interested. And we are always here if anyone has any questions or concerns with regards to tonight's session. If you have questions, you need to please send it via the Google form. You can find it in the chat box. And this is just to keep our chat box distraction free, so we can all focus and concentrate and not have things pop up all the time. And also you will be anonymous, so you don't have to say please keep me anonymous, because you will be anonymous via the Google form. You're not saving your name or email address or anything like that. So I will now introduce our speaker for tonight's session. Dr. Feroza Arbee was raised in rural Mpumalanga with a strong sense of community and social responsibility. She moved to Johannesburg after school, where she obtained her undergraduate medical degree. She met her husband and married while still a student. She had a firstborn while specializing as a psychiatrist. Currently, she is a married mother of 3 and runs a private psychiatric practice. Observing the challenges faced by her mother and other women in her family while growing up, as well as her own experiences while schooling, studying, in marriage and mothering, Feroza developed a keen interest in women's coping skills and mental health. She is fascinated by cultural and religious influences on the presentation of mental illness, treatment preferences, and social perceptions. She strongly advocates social awareness and destigmatization of mental illness, especially in the Indian Muslim community. So we welcome Dr. Feroza Arbee. Please switch off your videos. There's no need for it to be on. And we will now begin. Bismillahir Rahmanir Rahim.
Assalamu alaikum, Sister Waslia. Jazakallah for having me. Can you hear me?
I can hear you and see you clearly, alhamdulillah. Shukran for being with us today.
Jazakallah khair for inviting me. Okay, so I'm going to go straight to my presentation because I've got a lot to cover today. All right. So, assalamu alaikum to all those who are participating in tonight's webinar, and I hope it will be a fruitful one. The topic that I'm presenting tonight is called Mind the Gap, an overview of mental illness. I think I could probably talk for hours long, so I've tried to put as much as I can, but also try and keep it relevant to everyone present this evening. Wasfi has already introduced me, so there's no need for me to go there. Let me just see if I can actually move now. Trying to see if I can get my slides to actually move. That would be best. Here we go. So mental illness, the definition of mental illness is a health condition that involves changes in emotion, thinking, and or behavior, or a combination of these, associated with distress and functional impairment in the social, work, or family spheres. It is the second leading cause of disability worldwide. I want everyone just to pause and think what that means. It's the second leading cause of disability worldwide. This does not mean it causes a lot of deaths, but disability, which really means that people aren't functioning as well as they should, and it's a second leading cause. Half of all mental illnesses start before the age of 14. And that is quite worrying, because I think people have the idea that mental illness is something that happens later on in life. Yes, it may become more prominent later as you have more stresses and responsibilities, but it can start, and most of it starts actually before the age of 14. Since we've experienced COVID, mental illnesses have increased and are still increased. We have not felt the impact of the epidemic, the full impact of the epidemic yet. It will be with us for years to come. There's both a direct and indirect risk, and what this means is that patients who have had COVID have a direct risk, and those who have not had COVID are still at risk because they are affected by the COVID pandemic. And I'll go into a bit more detail as well. This has resulted in increased grief. We've all experienced losses, uncertainty. None of us know where our next paycheck's going to come from, or whether the world will be the same tomorrow, or when the next lockdown will start, and when the next wave will affect us. We all have lots of stress, lots of turbulence, anxiety, insomnia, depression. And there's this new word terminology that's come up, long COVID. And what long COVID stands for, it involves people who have had COVID, who still have some symptoms months later that seem to be from the COVID. From a psychiatric or psychological point of view, that really is patients or people who are having problems concentrating, unable to learn new things, or find themselves functioning less than they did previously. So for example, if you were a teacher, you find yourself not being able to teach the same amount of hours in a day, feeling very tired or fatigued, unable to lesson prep as much as you used to, unable to remember things that you used to know before suddenly seem unfamiliar or that you need to relearn. There are also people who are increasing their self-harm, and there's a higher risk of substance abuse. India and China report a 20 to 50% increase in mental illnesses. Just to give you some perspective, worldwide, the frequency of anxiety is 16%. China's reporting currently a prevalence of 32% of anxiety. We don't have numbers yet for South Africa, but that's double. That's something we're not equipped for. The current mental health professionals, psychologists, psychiatrists, social workers, we're barely coping with what's happening out there pre-COVID, let alone what's going to be coming for us or what's out there right now. So the situation in South Africa, and I know we've got a large global population, and I know not everyone's from South Africa, but I thought you'd find this interesting. Up to a third of South Africans will experience mental illness at one point or at some point in their lives. Pause. If you are 6 people in a household, that's 2 people that will experience mental illness. So no one out there can say to me, mental illness does not affect me. You may not have or experience it yourself, but someone you know and love is definitely going to be experiencing it. What's even more scary is that 75% will not access appropriate help. So 75% of these, a third of our population, will not seek appropriate help at all. South African Depression and Anxiety Group reports 22 suicides daily, and this is subsequent to the COVID pandemic. We've not yet seen the full impact of COVID, like I've mentioned before. Neither do we have South African stats on what the COVID pandemic has done to our mental health. 17 million South Africans suffer from depression, substance abuse, anxiety, bipolar disorder, and schizophrenia. We call these the top 5 in psychiatry. 17 million South Africans. 1 in 2 new mothers experience symptoms of perinatal depression, that is either depression or anxiety during the pregnancy or postpartum. 1 in 2 new mothers. These are shocking stats. Yet the Department of Health spends 4% of our national budget for health on this crisis. 4%. And their reasoning is that simply we're not losing patients. They're not dying. Now that's the reason why we have such a small allocation of budget. So what this means is that mental health has become the orphan of the healthcare system. It's largely managed by NGOs or NPOs on whom the responsibility is now to decrease stigma, to educate, to create social media awareness or public awareness, and to actually, in a lot of cases, provide telephonic or telehealth services, counseling lines or telephone lines. And a lot of our communities have organizations, and these are largely privately funded or funded by big corporate companies. We have, however, one of the most progressive mental health legislations in the world. So post 1994, there was a complete overhaul of a large part of our legislation. Mental health was one of those. We have the Mental Health Care Act of 2002, which is one of the most progressive mental health legislations. But as with a lot of things in South Africa, the idea is good, the intention is there, but the implementation is the problem. And this has resulted in long waiting lists, appalling inpatient conditions, a lot of neglect of our mental health care users, discrimination and tragedy. As we remember with the Life Esidimeni saga, where a large population of mental health care users or previously institutionalized users were transferred to non-licensed to unlicensed facilities, and which led to a lot of these patients dying. We had over 150 deaths. In some cases, the conditions under which they were found were quite shocking. In fact, there's still a few patients unaccounted for. The paperwork wasn't in order. No one knows where they are. And that's quite serious. That's a complete human rights violation. But we also have a problem. We have a huge private sector that are regulated by medical aids. And then we've got the state, a lot of people reliant on the state facilities. And this divide means that 85% of the country's psychologists practice privately, servicing 14% of the country's population. So that's a huge divide right there. And I think part of the mental health legislation is to try and gap this divide, to try and bridge this gap and try and find a way in which more of our population is able to access primary mental health services. As a result, currently, we're experiencing increased presentation of stress-related illnesses to GPs. And among these are irritable bowel syndrome, migraines, chest pains, and other physical manifestations of stress. Some GPs report that 60 to 70% of their practice is stress-related. So obviously the grounding or the knowledge or the training in the undergrad degrees needs to be really good from a psychiatric point of view. Now, while we have large clusters of disease, so I've mentioned mood disorders or depression, I've mentioned schizophrenia or psychotic disorders, we've mentioned substances, and among the mood disorders, you would get depression and bipolar, also the anxiety cluster of illnesses, but the general symptoms of mental illness is quite common. I mean, a lot of, you would experience a lot of these symptoms that I'm about to mention. It doesn't matter what mental illness you're going to get. And this is what I spoke about, where it affects the three clusters of social, work, and home. So you have a loss of interest or pleasure in your leisure activities. If something gave you joy or fun before, for example, maybe going out for coffee with your friends, when you start to develop a mental illness, you would find even that going out for coffee doesn't give you such pleasure, and you find less joy. You have consistently low energy, fatigue, or sleep problems, a feeling like nothing matters, a feeling of persistent sadness, low mood or anxiety. You need not have all of these symptoms, perhaps even some of them. There can be behavioral changes, for example, starting to neglect responsibilities, having mood that is out of character. The neglecting responsibilities could be in any sphere of your life, work, school, home. Socially, with COVID, we're not seeing the neglect in social responsibilities because that's been forced on us with COVID. But a fair amount of my patients tell me that even when the opportunity arises to socialize, they don't feel like it. So they would actually use COVID as an excuse to say, I can't come for that, or I won't be available for that, when in essence, they just don't feel like going. So changes in behavior, you can get agitated or aggressive behavior, fixed false beliefs, hearing voices or seeing things that aren't there. That's the hallmark of psychosis. A lack of realization or awareness, sometimes even of your own symptoms, or being dissociated. So almost feeling like you're not in your body, that this is happening to someone else. I'm going to share a slide of what people think depression looks like. So I chose the slide because for me, it's an accurate description of what people think what depression looks like. It's dark. There are no features, there's no characteristics. This could be anyone sitting alone at home in the dark, covered up, eating takeaways with no one else there and just sort of slumping over with no interest. But I'll share another slide with you later of what depression can look like, and it's sometimes not as obvious as this. Some of the other symptoms you could present with would be increased use of substances, including alcohol, cigarettes, cannabis, painkillers, drugs, I think we sometimes think that doesn't affect us. We know what drug addicts look like. They're those people that hang around at the corner of the street and they look like drug addicts. But I see a lot of patients, a lot of ordinary people, housewives who are using painkillers, husbands who come in and tell me they're not eating or they're not sleeping and they're using their mother's pain medication or sedatives, or their sister gave them some Alzam or Xeno. And that's really what I'm talking about. And that's sometimes harder because people don't see it for the problem that it is. They may also experience uncharacteristic emotions. So someone who's normally quite passive may be quite irritable. On the other hand, someone who's quite loud and talkative may suddenly be very quiet. The confusion and fogginess that I spoke about, ruminating, which is talking a lot of or being stuck on events, either past or present events that are happening. Thoughts of self-harm, not necessarily suicidal thoughts, but sometimes people say, I feel like driving into a tree. I wonder what would happen if I banged my head against the wall, or I sometimes just feel like hitting myself. Extreme irritability, changes in eating habits. You can either get a loss of appetite, or you can get people who start to binge eat from a psychological point of view, but there's no pleasure or joy in eating, and there isn't a feeling of being satisfied. Children may report difficulty concentrating or learning, or people where just generally having to concentrate is necessary for their job, so people in corporate. Who has been most affected? And this, I specifically listed the people, the populations at risk specifically with COVID. So I've mentioned children and adolescents as first. Adolescence is normally a turbulent time. From a physical and psychological point of view, it's already a turbulent time. Hormones are raging, self-esteem and identities become erratic. As adolescents are trying to form their own identity, but at the same time trying to leave the dependence of their home structure perhaps, or figure out who they are. And then we've stuck them into a pandemic. We've said no school, no social life. The two parts that have really lent them to an identity outside of their home, we've taken it away from them. So there's no hanging out with friends, there's no place to bounce off their feelings or to pick up that this is okay, to gauge themselves against other people, really. We've then asked them to learn online without having a teacher present, without anyone to monitor if they're able to pay attention, and we've taken away their friends. It's become an increasingly hard time. In addition, we've stuck them at home, where perhaps the home structure may not be the most stable one. A lot of our patients live below the breadline, so that one meal a day that they were getting at school, the presence of other safe adults, maybe we've taken that away from them. They're then exposed to stressors at home, where mom and dad perhaps are very stressed about the COVID situation or economics or finances. They're then exposed to that. They may be exposed to abuse in the home, or they may be asked to parent younger siblings because those siblings are not going to school either. So we're really putting already an at-risk population at even larger risk. And so the risk of substance abuse, violence, and suicide increases in that population. What is alarming for me is that 10% of our adolescents die by suicide. Largest proportion of any population group, 10% of adolescents die by suicide. What makes this even more complicated, they cannot seek help alone. They're minors, so they've got to go with a trusted adult. Doctors need consent from a parent, so they would need to divulge or talk to a parent that they trust enough to hold what they're about to say to them, as well as get them the appropriate help. Often parents have their own issues, maybe quite dismissive, or maybe the problem in the first place. They also may have trust issues that the doctor or psychologist or professional that they're talking to may divulge quite sensitive information to their parents. So it is really a difficult population to reach, and we often have adolescents who present because they've become problem children at home. So they're the identified patient. They would be the ones that come to us, but then we would realize the situation is bigger than them and there are problems in the home. So we've got to use a multimodal approach where you're treating an adolescent as well as a family, and we frequently involve the school. The other populations that are at risk are employers who are undergoing huge economic stresses and uncertainty, as well as facing labor law, who doesn't care whether they're earning or not, but wants to make sure that they're able to fulfill the rights of their employees. Breadwinners, so whether these are self-employed or employed by others, they fear retrenchment and having the financial responsibility of taking care of families. Those who've been affected by COVID, and not necessarily COVID infected. We have all been affected by COVID. So the isolation, the social distancing, the lockdowns. These have been particularly difficult on families that live far away or in isolated areas. We all know what this did, or what this is still doing to our older population who are perhaps living on their own or in old age homes. They have very minimal social interactions as it is, and isolation in lockdown has made that really worse. For our children, one of the things that hit home for me was when my son came home to tell me that they're not allowed to play on the jungle gym together with his friends. My son is 6. And when they do play, when they were finally allowed to play, only 4 at a time. So this is a huge chunk of his social maturity or social development that has been taken away from him. We talked about the long COVID, and then obviously there are the losses and the grief. So we've all experienced losses, grief. In a lot of cases, there isn't an opportunity for closure. Some patients have died in hospital. Family was not allowed to greet them or even hold a proper funeral for them. And then there are those that have been in hospital who saw horrible medical conditions, who perhaps saw patients around them dying or needed to be on a ventilator themselves, on oxygen, or had to see very exhausted nursing or medical staff around them, perhaps even negligent staff, but this has been quite traumatic. And then we add to this whole dynamic, we add the previously traumatized or the previously unwell. So the known patients who were from before COVID who are unwell, they are at higher risk. There's been limited access to services. So we went into a lockdown where most services shut down or were very minimally accessible. And this has led to non-compliance as well. Right, I'll go a little bit into the particular psychiatric disorders. I've discussed some of the common symptoms to all the psychiatric disorders. And I want to go a little bit into all of them, the big few. Anxiety disorders, this affects 16% of the population. This is pre-COVID. Can tell you just from my own practice that this number is increased. I think we're looking in the region of 30 to 50% actually of our general population that's experiencing some degree of anxiety, whether this be comorbid with depression or physical illness or any other illness that may be happening at the same time, but it also stand alone by itself. So we have a few types of anxiety clusters that I want to talk about. The first one is a generalized anxiety. That's a distressing emotional state of nervousness and unease. This has both physical and psychological symptoms. So the psychological symptoms would be the ruminating that I spoke about, finding something going on in your head, unable to leave your mind, your thoughts are racing, you find your brain unable to switch off when you go to bed, and you find sometimes that even when you want to not think about something, your brain still takes you there. You acknowledge that you're worrying excessively, you're constantly checking what you can check, you're constantly perhaps displaying behavior that's uncharacteristic of yourself, and these symptoms are there disproportionate to the thing that is worrying you. Physical symptoms, this can be pain, tension, jaw tension. A lot of people tell me they feel tension here and they've got to physically unhook their jaws. We also have increased heart rate or feeling like you're unable to take a deep enough breath, that you've got to breathe harder or faster to get the same amount of oxygen in. A feeling of tension or a stomach ache, for example, a lot of headaches. So there's a lot of physical symptoms and psychological symptoms. A lot of these people who are experiencing for the first time will go to their GPs and report that they think there's something wrong. Perhaps it's their heart, maybe they're having a heart attack or even a stroke. This is a daily worry or anxiety, and it can lead to functional impairment. And what I mean by that is that you're not doing as well as you used to do the things you used to do before. So for example, I'll use myself as an example. If I'm a working mom, but I'm also a wife, I've got school rounds to do, I may find that I'm taking strain doing those things. So there's a definite feeling of taking more energy to do what you could do before. It can also affect your physical health. This is cardiovascular or autoimmune. So for patients who have autoimmune diseases like arthritis or thyroid or asthma, and in the cardiovascular, having chest problems or high cholesterol, all of these may be affected. Even diabetes, we often find that patients' diabetes is out of control because they have high levels of anxiety. Panic attacks are when the symptoms that I've discussed, the physical and psychological symptoms, sort of reach a crescendo. So they reach a peak within a few minutes. They feel quite out of control. It can be quite alarming and overwhelming, and then it stops. It'll wear off. Doesn't actually completely go away, but it's the brain's way of discharging some of this difficult to hold anxiety symptoms, almost like it's gotten rid of some of it, like a pressure cooker that's finding a space or a hole within which to let go of some of the pressure. And a panic attack can feel like that. It can be quite overwhelming, can feel, a lot of patients tell us that they feel like they were having a heart attack or a stroke, but it lasts a few minutes and then it goes away. They feel quite exhausted or depleted after. Post-traumatic stress disorder, that's what PTSD stands for, recurrent intrusive thoughts of trauma. I've mentioned the COVID trauma, but also there's been riots recently in KZN, and we're also looking at high rates of crime because people are becoming more desperate. So there may be lots of subsequent effects of COVID as well. The next point is very important. These anxiety disorders evolve into abnormalities of your neurotransmitter system. So serotonin, adrenaline, noradrenaline, and GABA, if we do tests on these patients, we find that these are abnormal. So for the people who believe that mental illness is in your head, it's something you can just shake off. That's not true, because we do have biological abnormalities in patients who have certain disorders. And that for me tells me this is a biochemical or a medical illness. And that is actually why the medication works, because the medication treats those chemical abnormalities and tries to reverse it or bring it back to normal phases, normal spaces. Unfortunately, in South Africa, it's very difficult and very expensive. In fact, worldwide, it doesn't make sense to test for these. But it is available. We can do lumbar punctures or access your cerebrospinal fluid, which is the clearest indication of what's happening around your brain. Or we can do functional MRI or SPECT scanning, both of which are very expensive and not freely available. So for the people who believe that this is all something that's in your attitude or your perspective, that's not true. These are actually biological illnesses. They may not necessarily start like that. But once you've been exposed to trauma or recurrent traumas or stressors, they definitely do result in an abnormality in your biological systems. Mood disorders. So the mood disorders are two kinds specifically. There's major depressive disorder, which is also known as unipolar disorder. These are pervasive feelings of sadness or low mood, accompanied by other physical symptoms or psychological symptoms lasting at least 2 weeks. They may be hereditary and psychosocial contributions. And what that means is you may have a hereditary or genetic predisposition to being depressed, but then you may also have risk factors or events through your life, so a traumatic childhood or other big events happening in your life that can contribute to unmasking major depressive disorder or to evolution of major depressive disorder. Bipolar disorder, I know a lot of people are interested in bipolar disorder. These are episodes of depression, yes, but also mania or hypomania, and I'll talk a little bit about that now, or irritability, excessive levels of irritability. They also happen for a few days at a time. So for someone who says, I was feeling so aggressive this morning, but after lunch I was fine. And then in the evening again, I was irritable. That generally tends not to be bipolar disorder. But this results in changes in mood. So with mania or hypomania, you have an excessively high mood. High does not mean happy. Not in all cases. We get people who are high, but irritable high. They generally have lots of energy. Their speech is usually increased and fast. So they go from topic to topic, and the person who's listening obviously feels like they're missing a few steps in between, but the bipolar brain jumps from topic to topic. They may have higher amounts of activity, though not all of it is goal-directed. And what that means is, even though they're doing more, they may not be getting more done. So they'll start a lot of things, they may not finish it. These are the people who are up at 3 a.m. cleaning the house or washing their curtains or working on their next thesis. But when they're out of their manic episodes, frequently they realize perhaps it didn't make a lot of sense. They have a decreased need for sleep. So again, this is not the person who's not sleeping because they can't sleep. Bipolar patients don't need a lot of sleep. They'll tell you they went to bed at 2 a.m., they woke up at 5 and they were fresh. They could get things done or they were wide awake and they didn't need sleep. Cognition refers to our brain functions. So concentration, learning, planning, memory. Bipolar is frequently very traumatic, very impulsive. You've seen it, you tend not to forget it. I always tell my patients, bipolar is not something foreign. It's not you're a whole new person, no one knows who you are. You are yourself, but you have almost, I call it filters removed. So, and I want to use an example for that. So sometimes you see someone and they're wearing a hideous outfit. Our social filters tell us that we cannot tell someone their outfit's hideous. So we put in a few filters and we and ah, but we don't insult the person. We may say something like, no, maybe you look better in the other jersey. But a bipolar patient would blurt it out. That looks hideous. Where did you get it from? That's awful. And so you think of a bipolar person without a few filters. So if they feel like buying that 900 Rand handbag that they saw, you would go, oh, okay, maybe next month, maybe if I get a gift voucher for my birthday, or, you have some filters that would hold you back from buying it. The person with bipolar doesn't think twice. They would go into that shop, buy it, even if it means they can't pay the rent at the end of the month. There is a higher risk of developing bipolar in the perinatal period, that is during pregnancy and postpartum, purely because there's a huge hormonal flux during that time. So there's huge hormonal fluctuation, and a lot of women who have the predisposition for bipolar. And what that means is if you've got bipolar running in your family, if your mom, your aunts, your grandmother, or someone else in the family had it, you have a higher risk. And if it's going to happen, in all likelihood, it will happen postnatally. This also affects your serotonin, noradrenaline, and dopamine pathways. So again, this is a biological mental illness. Substance use and abuse. 1 in 5 South Africans abuse mind-altering substances, namely alcohol, painkillers, cannabis, tuk, which is a stimulant-based drug, heroin, and cocaine. This results in absenteeism, neglect of their responsibilities, a loss of productivity, increased health costs, drug-related crime. During COVID, we find people are using more of substances because they're less able to use other stress-relieving measures. So, for example, people are socializing less, able to exercise less, going outdoors less, and traveling less. So they're sitting at home, they're self-medicating to relieve insomnia, stress, boredom, perhaps other things as well. And also there's an increased accessibility. So online sales, for example, these days you can go online. There's so many websites selling CBD oil and cannabis gummies and a whole lot of things, and they'll deliver it to your house. There's also less restrictive legislation, and it's become so freely available. A lot of people don't realize, they think that because I can get it freely, or whenever I walk into a mall, there's a little stall that's selling cannabis something or the other, that it must be okay because I can buy it wherever. But for some people who have a genetic predisposition to mood or psychotic illnesses, this is probably not the safest thing you should be doing. Also, be very clear in what you're treating and whether you're self-medicating symptoms. I won't go into a lot more detail here. So what are we aiming for? I've mentioned what mental illnesses are, but we're not aiming for treating a mental illness. We're aiming for mental health. And the WHO definition for that is a state of well-being in which every individual realizes his or her own potential, can cope with normal stresses of life, can work productively and fruitfully, and is able to make a contribution to his or her community. So for a lot of my mentally unwell patients, we try and get them to survive their illnesses, but we also want them to thrive in life. And that's what we're aiming for, mental health. We don't want you to just be okay and not be in hospital or be stable on your meds. We want you to do well. We want you to be, the younger generation's got the nice phrase for it, to be the best you, to be the best person you can be, to do you. This includes an individual's emotional, psychological, and social well-being. Mental health is not the absence of illness or disease. I want you to just look at the second sentence there. It includes an individual's emotional, psychological, and social well-being. And this is particularly important for the next aspect of the talk. The Islamic perspective. Because what I just mentioned there is really important from an Islamic point of view, and I'll discuss why. The Islamic perspective has developed and been developing for centuries, drawn largely from the Quran and the Hadith. The Prophet and the companions were not exempt from feelings of sorrow and intense emotion. In fact, when the Quran was revealed, they didn't have words for depression. They used words such as sorrow and grief and other intense emotions described in the Arabic language, and this draws parallels with what modern psychology calls depression. If we look at the symptoms that were described, we can say that they were actually talking in some instances of beyond sorrow and grief. They were talking about depression. So Hazrat Yaqub alayhi salam experienced such intense sadness when he thought he lost his son Yusuf alayhi salam. He cried so much and he grieved so hard, this cost him his eyesight. In psychiatry today, we would call that a psychosomatic manifestation of his stress. So the psychiatry is not a modern field. It didn't evolve out of nothing. It evolved out of symptoms and conditions that were present before, and we've just now found better words to use to express those. So if we read the story of Hazrat Yaqub alayhi salam, in fact, the entire Surah Yusuf talks about intense emotions and sadness. The entire story, the entire Surah is based on emotions and self-esteem. It's actually a very interesting Surah to read from, even from a mental health perspective. And so the psychosomatic manifestation of grief was something that we psychiatrists are quite familiar with. Our Prophet Muhammad ﷺ experienced such intense grief after losing his wife and his uncle in the same year that it was called the year of sorrow. I'm going to say this again. Our Prophet Muhammad ﷺ did not suppress his grief. He experienced it, he expressed it. He did so with patience, correct, yes. But he did not suppress it, or he was not told by his companions that there was something wrong with him. They understood, they supported him, and it was called in history as the year of sorrow. When he lost his son, baby Ibrahim, he lost all of his sons. He didn't have a single son who lived into childhood, actually. He said, the eyes are shedding tears and the heart is grieved, and we will not say except what pleases our Lord. Hear this again, the eyes are shedding tears. There were physical manifestations of his grief. He showed it. The heart is grieved. Does this not sound like what you hear when people tell you that they're depressed or that they're feeling sadness? But we will not say except what pleases our Lord. So from an Islamic perspective, we're allowed to grieve. We're allowed to be sad. We're allowed to express our emotions. We're just not allowed to say, why me? Question what Allah has given us. And in fact, the first dedicated psychiatric hospitals were founded by Muslims in the 9th century, first in Baghdad and then in Cairo. We often use, from an Islamic perspective, you need to consider the Quran as a guide to the humankind suffering. It's said in the Quran that there is no disease that Allah has created, except that He has also created its treatment or its cure. If He sent down bipolar, schizophrenia, the cure is there, the treatment is there. I'm not saying psychiatrists have it, I'm saying that it is there. And as good human beings, as good Muslims, we need to actually go and seek the cure. So, Islam values good mental health and emotional well-being. This resonates with the sentence I gave you when I said the WHO definition of mental health is good mental health, social and emotional well-being. Islam values this. Islam is saying, take care of your mental health. Gaining awareness into your psychological and spiritual functioning is necessary to form a meaningful relationship with Allah. You cannot not know what you're about and have a proper relationship with Allah. If you're going into your salah, just doing things, just reading, without an understanding of what that is, what that means for you, that's something to consider as well. Islam does not require us to be superhuman, but it requires us to seek help, to take care of the amanat given to us. The amanat that I'm talking about specifically is our body, our mind, our emotions, our soul. And so that's the amanat given to us. And you cannot be a good Muslim without being aware of those things. So it is not up to us to criticize. If someone else is experiencing something you do not understand, do not criticize. Rather, offer a solution to regain psychological and mental health. And while I'm on this point, telling someone to make sabr is not helpful. They have been. They are trying to be. If they're talking to you about it, that means they trust you enough that you will hold that space for them while they explore their own problem. All of what I've mentioned above can be considered a form of ibadah. So if you think of it from that perspective as a Muslim, trying to seek help if what's going on is beyond you, trying to better yourself with the intention of bettering yourself, that is a form of ibadah. Won't we get sawab for that? So I want to touch on a few of the myths and misconceptions before I head on to the questions. There are a lot of myths and misconceptions, and I have not put all of it here, and some of it you'll find will overlap. So the myths and misconceptions: mental health is a taboo subject. It leads to embarrassment and fear. I mean, how many of us actually sit around with our families and talk about our own mental health? We don't. We don't want to appear weak. We don't want someone to belittle us or tell us to just get over it or it's in your head. So we're afraid of stigma. And this kind of discrimination leads to someone not seeking help, being resistant to treatment, or even stopping the treatment because people say to you, what are you taking those pills for? You'll become addicted. So let's talk about some of these. Mental illness does not or will not affect me. Rubbish. I've already told you 1 in 3 will be affected or have a mental illness in their lives. So if you are those lucky 2 out of 3 that don't experience mental illness, then somebody you know is going to be having it or experiencing it. So it will affect you, even if it's not directly. People who see a therapist or on meds are crazy. My view of the patients that I see, these are normal people who need a little bit of extra help to navigate their current life situation. In fact, I have a great admiration for these people because they come and see me to say to me, I don't feel okay and I'm looking for help. That's a sign of courage and strength. That's not someone who's crazy. The crazy people are the ones sitting at home who refuse to get help because they don't think that it will work, but don't want to try, afraid of what people say or what people think. Well, those people aren't paying your bills and they're not the ones that have to live your life. So be proactive. You do not have to take medication. I'm going to talk about that in a minute. Psychiatric meds are addictive. Yes, a small percentage of them are. Go and see someone decent, someone qualified. Don't take meds from your sister or your sister-in-law or your daughter, whoever. Go and see a professional so that they can talk you through what meds are for what, which ones are addictive. Reason we do use medications that are potentially addictive, they work in the short term, they can provide instant help while the longer term meds kick in. So responsible use is available. See someone who is qualified. I will need to be on meds for life. Unfortunately, some of the psychiatric conditions are biological or may be lifelong. In that case, you may need to be on meds for a long time. But I would say a lot of my patients come and see me and I don't need to be on medication for life. You need to think of having an anxiety disorder or a depressive episode, almost like having a broken leg. If you had a broken leg, would you go and see the orthopedic surgeon or the GP or the casualty? Yes. Why? Because they're going to put a crutch on, they're going to give you crutches and they're going to put a cast on. A lot of times medication functions like that cast. It doesn't heal your leg, but it provides the situation necessary or the conditions necessary for your leg to heal from the inside. And it's the same thing like that for most mood disorders and anxiety. We give you medication to take the edge off enough for you to make the changes necessary for healing. Yes, and I tell my patients this, when we do an X-ray, we'll always know you had a fracture. But from outside, I will not be able to see that you should not be able to walk with a limp forever. Same thing with medication. You don't look okay now. We'll start you on medication if you have an anxiety or a depressive disorder, and you slowly start to change the things that are making you anxious or depressed, or you start to process whatever's happened to you. And eventually we start to wean you off the medication, knowing that you're better equipped in terms of your coping skills to live the rest of your life, hopefully not having a relapse. And if you do, we'll deal with it then. A lot of people resist therapy. They say our problems are private. How can a stranger help me? Well, if you're having a problem or you're having a disorder severe enough to be giving you functional impairment, your home situation is not helping you. You've tried, you've spoken to everyone at home or to your friends, and perhaps they're not quite giving you the perspective that you need. An objective perspective in a space where your feelings are held, where someone's not giving you a direct solution or dismissing your concerns and saying, just change how you think. Just wake up for tahajjud. Just do this. Just go to the mosque. You'll be fine. You've done all of that. So come and see someone where your space is being held, who can perhaps help you navigate that space or that problem so that you can come to a point where you're able to help yourself. And for someone who's appropriately trained to facilitate that kind of healing. So again, we come to if I stop my meds, I'll still have the same problems. Yes, if you don't process what happened to you or what caused the problem in the first place. But you will also be in a better space to navigate that. So for example, let's take the example of the person with the crutch. If they suddenly just throw the crutch away, will they not be able to walk? Probably, if they haven't exercised the leg, or if they've not done physio, if they've not increased the mobility in the leg, you would still need to do those things to start to walk properly. So mental illness is not a quick fix. Here's some pills, let me give you a script, you're going to be okay. No, it's work, but we provide the facility or the conditions for you to reach those goals. Mental illness, this is probably the favorite one in the Muslim community. Mental illness is a sign of poor Iman, it's a sign of a weakness, it's a sign of ingratitude. And then we get the snap out of it, the Make Sabr Brigade. Mental illness is not a sign of poor Iman. It's not a sign of weakness, it's not a sign of ingratitude. If our prophets and his companion, our prophet and the other prophets and his companions were tested, was that a display of poor Iman? Were they weak? When our prophet lost his 4 sons and he grieved, was he weak? Was he ungrateful to Allah? No. No one said to him, snap out of it. In fact, Allah Ta'ala revealed Surah Duha when the prophet was at his lowest, when he felt that Allah had forgotten him. Allah revealed Surah Duha. Good thing for someone who's struggling, who feels often that like they've been forgotten by Allah Ta'ala, to go and read that. So it's not a punishment or a curse from Allah. We often look at someone and go, oh, that person doesn't have Iman. Look how weak they are. They don't have any trust that Allah has in Allah. That's not true. I would agree, and I view, personally, I believe that we are all given tests in our lives, whether that test is a physical illness or a psychological illness or a financial stress. We're all given tests. What we do with that, these are not signs of poor Iman. What we do in those tests is what's going to determine the quality and value that we have. It's all in your mind or head. Change your attitude. I've already mentioned that. So for the people who tell you to start to read Tahajjud Salah, it's very helpful. It is helpful, sure. You've got the energy. When I see patients who are depressed, they'll tell you that they struggle sometimes to even brush their teeth. If none of brushing their teeth, tell me where they're going to find the energy or the willpower to get up at 2 a.m. and read Tahajjud Salah. There's another myth that non-Muslim professionals will impose their beliefs on you and undermine your Islamic values. Health professionals are trained to be objective. So even from an Islamic point of view, I am giving a talk from an Islamic perspective, or at least part of it from an Islamic perspective this evening, but I treat many non-Muslims. I do not impose my beliefs on them, neither do I allow their beliefs to. If I feel and I see that you're a spiritual person, I will ask you to tap into that. If you're someone and I see all kinds of, the stuff that we experience in the Muslim community is not unique to us. I have seen rabbis and pastors who come to see me because in their own faith, they cannot go and see someone of their own faith in case it is viewed as a weakness or an ingratitude or a lack of faith. So this is not unique to Muslims that we see this way. And so we cannot impose our spiritual beliefs on you. So I get Muslims who perhaps not very religious or spiritual, and I don't turn on them or criticize them. I meet them where they're at, always with an idea that we would push them into being able to find themselves better. And Islamically, we have the tools at our disposal. You just have to look. Consulting an imam is enough for mental challenges. And I put this here and I hope I don't get shot down. The reason I'm saying this is our alims and mulanas are not adequately trained to screen for mental health challenges. When they encounter something that is beyond the spiritual realm, they don't often encourage these patients to go and see a doctor, not often in my experience at least. So when you're consulting an imam, yes, for your spiritual needs, or if you think that is what's necessary, yes, but if you're seeing it's beyond the imam or the Maulana's abilities to guide you, do go and see a professional that's been trained in mental health disorders, specifically the biological ones. The next one is, I will lose my rights and freedom if I'm a mental health patient. Incorrect. I mentioned earlier, I have a great respect for people who come to see me saying, I'm not okay, please help me. In fact, you will regain your rights and you will find yourself more empowered just by having sought help. Remember, you do not need to follow every instruction given to you by a doctor. You just need to empower yourself to know what would work best for you. And obviously, if you're not in a space to do that, what a doctor may suggest may be the right thing for you. I've already mentioned there's no depression in Islam. Depression does not pick and choose. I see many very religious Muslims, very devout Muslims. And on the other hand, I see many Muslims that are Muslim in name only, and they're perfectly fine. They have no sign of depression on the other hand. So it works both ways. There's no discrimination there. Medication is not good for me or will change my personality. I should hope not. If you're finding yourself feeling out of sorts or not feeling yourself on your medication, certainly you can discuss with your doctor and adjustments can be made. Please know that there is no one size fits all. If just because this amount of medication worked for this person does not mean it will work for you. It's a bit of trial and error. You need to be met where you're at with your medication, and it takes a bit of time to get there. And throughout your life, your mental state will change. So too does your medication need to be flexible to keep up with the flux of your mental state. I actually like this video, and this is what I chose. This is what depression looks like. People put on a mask, and they live their lives telling everyone, I'm fine. And they live with it alone. They feel if I can go out there and fake it, nobody will know that I'm not okay. This is often what depression looks like. But at some point, it becomes too much. On their own, they realize it's not okay. They're not okay. Okay. So in conclusion from my side, Prophet Muhammad ﷺ said, no fatigue and see the word fatigue is one of the key points or the most common symptom of mental illness. No disease, no hurt, no distress befalls a Muslim, even if it were the prick he receives from a thorn, but that Allah expiates some of his sins for that. And the reason I chose this hadith particularly is that even though you feel the people around you may not understand, know that Allah knows everything, right? So even if you're not feeling his presence in your life, or you're not feeling your Iman, know that it's there. I'm going to stop my video for a few minutes so that I can just browse through some of these questions that have been sent to me, and then I'm going to pick and go through as many of these as possible, actually. Okay. So the first question I've been sent is, I have depression, have issues with prayers. As a recent revert, I don't have an emotional connection with the prayer yet. It is just something that I have to do. My issue is that when the depression is bad, praying is getting very difficult for me because it is a chore. And just like other chores, it takes a lot of energy for me to do. I sometimes miss prayers because of that. And then I feel terrible and spiral into thinking, why do I suffer in this dunya just to suffer in the akhirah as well? Because I miss prayers, so I'll go to hell. Do you have any advice? I have touched on this briefly, and I want to say that that's exactly what I'm talking about. So when people give you advice of read the tahajjud or do something extra, you're struggling with the basics as it is. To this brother or sister who sent me this question, your prayers are compulsory, they're for us. Just like how you say you do your chores, but it takes energy. Simple, sit down, do it, make your salah, even if it takes a lot of energy from you. And just sit there with it. The dua you need to make is, Allah, you can see where I'm at. Send the cure. Then you can see. And my conclusion here is exactly answering the question. Allah expiates some of these sins for that. Your suffering here on earth does not mean you're going to suffer in the akhirah either. The fact that you're making an effort, that's everything. If it feels too much of an effort, make huzur, sit on your musalla, make your dua. If that's the least you can do, that will be more than doing nothing. Right? Don't feel bad. Don't make it hard for yourself. Allah does not want you to criticize yourself or make yourself feel worse. That is the part of this test that you don't want to go down. You don't want to go down that road of making yourself hate yourself. Another question, I'm going through a lot to a point where I'm having numerous breakdowns. How do I cope with the nervous breakdowns? I'm very happy that you're able to recognize that you're not doing okay. Are you speaking to someone? Maybe you should be. No one should be going through so much by themselves. Every person who's got a problem does not need to be on medication. Speak to a therapist. There are people in your community who care, that are able to hold that space for you. Even if they can't change your situation, you may feel better just from sharing it or having a space where you can talk about it to someone that's not affected by your problems. Your doctor may also prescribe something just to help you with the specific breakdowns, to just calm you before they happen. How does one deal with anxiety and stress? There's so much information I can give you here, so I'm not going to go into all of it. What I am going to say is, you have anxiety and stress and they resemble the symptoms I mentioned, where they're there more often than not, and they're creating functional impairment. That's not okay. Go and see your GP, go and talk to someone. Nabila Gangat last week gave a very nice talk on self-care. She specifically aimed it at in the times of COVID, but I think that kind of self-care is useful all of the time. So perhaps do some of the self-care techniques that she mentioned. The talk is available on YouTube, and see where that takes you. But don't be afraid of seeking help. What can schools do to assist children in our care to overcome anxiety and depression? This is a very useful question, and I'm assuming it comes from a teacher. First things first, take care of yourself. So if you feel like you're able to take care of yourself, and then you're able to provide for the kids in your care. If there's a child that's looking like they're more likely to need a bit more, perhaps approach the parents. If there's a psychologist that's affiliated with the school, perhaps approach that psychologist for one-on-one attention, or even just a general assessment for that child. But I find with children, they're incredibly resilient. You can talk to the children, have a group session in class just to talk about what the children are experiencing, what they're going through. Would anyone like to share? And I think you'd find that a lot of kids are going through the same thing at the same time. If you're picking up slightly more, there are numerous screening tools online that you can use to see if this child or specific child needs more help. Does depression ever go away? If you're at high genetic risk, or you've had quite a traumatic childhood and multiple psychosocial or ongoing events, then the risk of experiencing depression on and off through your life is quite high. On the other hand, if something big has happened to you, or something happened to you many years ago but is not happening still, the possibility of the depression going away is very high. We find 60% of patients remit, that is, their depression resolves with the first treatment that we try. That's a huge amount. You have nothing to lose if you're living with depression for a long time. You have nothing to lose by seeking help that you've not sought before. Suicide is haram in Islam. I have the thoughts, what can I do to get it out of my head? These are caused by stress. The fact that you're recognizing that they're not okay, that suicide is haram. You know, I often have Muslim patients in my office and they're embarrassed and ashamed to tell me that they're suicidal because they feel I'm Muslim, I'll judge them. I see so many of these and I wish that people would just stop being so hard on themselves. Having a thought is not haram. What you do with that thought may be considered. So thinking, oh, I wish I could just grab a glass of wine, even though I've never had a glass of wine, but thinking it, oh, I wish I could be like people who could drink it and just switch off from my problems. Or find something that could switch off. I'm not advocating alcohol use in any way, but having the thought is not the problem. It's what you do with that thought. So if you're having these thoughts, go and speak to someone. This disempowers that thought. So go and talk to someone, let it out in the open. Just let it stop being that monster. It's like when children tell you there's a monster under their bed, and because they can't see it or they can't explain it to you, it takes on a life force of its own. You switch on the lights and you look under the bed, there is no monster. Suddenly it's much clearer what the situation is. The same thing with your brain. If you don't allow yourself to speak out loud or to write down what's going on in your head, it can be a life force in itself. It can feel like it's beyond your control, or you can feel quite overwhelmed. Go and speak to someone. Suicidal thoughts are not okay. You should not have to live with them by yourself. Another question, why does anxiety and depression affect our cognitive system? Which exercise is best to get your brain out of the foggy state, Shukran? So we need to consider, I'm going to give you a brief example of how depression and anxiety affects your biological state specifically, and that's the cognitive state as well. You've all heard of the fight, flight, freeze, and that is when we have a stress or a risk factor in an environment, or we have some kind of risk. So for example, if I was walking out on the street and a guy with a knife came at me, I would do one of three things. I would have a surge of adrenaline first, and that surge of adrenaline would determine whether I would fight the guy, whether I would run like hell, or whether I would stand there while he robbed me, right? So that's your fight, flight, freeze. But I would have a surge of adrenaline, and what the surge of adrenaline does, it sends a lot of blood to my brain so that my thoughts are sharp and clear. This dulls out the emotions because emotions are not essential for survival in that moment. It'll send a lot of blood to my heart and to my lungs so that I'm breathing harder. And I might feel myself hearing my breathing and hearing my heart pounding. I would have a lot more blood going to my muscles, my big muscles like my legs and my arms, so that in case I decided to run, I'd be able to do that. I would also be able to, but then I would also find there's a lot less blood going to my, sorry, I'm just trying to see if I can switch my video on. So you find a lot less blood going through your gastrointestinal system because absorption and digestive system is not essential for survival. Sorry, I'm just trying to switch on my video because I'm aware that this is very disconcerting to have me speak. Sorry. Not helping. I do apologize. I'm just trying to get to the slideshow again so that you can see my face in it. Perhaps just
No. So we stopped the shading. So you should have the camera icon at the bottom that you can just click on.
Yeah, it's not getting there. So let me exit this and go to Zoom. That should be better.
Yeah, you need to be in Zoom.
Yeah, here we go. Okay, start with it. That may just be a little bit less disconcerting for everybody else. All right, let me just go back to that question. We're talking about the fight flight. So what would happen is my body would deem that I need to be in fight flight for survival, really. So all of my adrenaline would be surging at that point. But when the risk is past, so when that guy runs off with my cell phone or whatever, I should be able to calm down and then get home or seek help in some way. Now, what happens is if you have multiple stressful incidents like that, your body forgets to shut down and switch off. You actually stay in that adrenergic hyperarousal state. you've had multiple small stressors or one massive stressor, like you've been hijacked, those people find themselves with PTSD. And what that means is they're constantly having this adrenergic surge, where their heart rate's going fast, but you're not feeling like they're getting enough air in, but their metabolism's slow, their digestion's slow, they're feeling constantly awake and alert and unable to switch off at night, and that leads to the insomnia, the poor concentration on everything else, the poor learning, the poor memory. And it sometimes needs assistance to get you out of that state. The question that is, why does anxiety and depression affect our cognitive system? That's how it does. So eventually the adrenergic state or the hyperadrenergic state, the excess adrenaline, will result in a negative feedback towards your serotonin. So it will reduce your serotonin level. So indirectly, after a while, this is going to lead to depression. High levels of anxiety inevitably lead to depression. High levels of depression are almost always associated with some levels of anxiety. And this is a biological chain in our brain. Right? So there's a direct link. I've got quite a nice picture in my office that I use to explain to patients who come in. What exercise is best to get your brain out of the foggy state? I assume the question means anything cardiovascular, right? So anything that's going to get your blood rate pumping, it's going to release endorphins, which are nice, pick me up. So they mimic your serotonin, and they pick up, they'll give you an instant feeling of feeling good. But if you don't have the energy for cardiovascular or cardio exercise, as it's called, do something mindful and relaxing, yoga, Pilates, something that's just going to be keeping you grounded, that is also amazing for anxiety. Anything that's going to increase your mind-body disconnect to letting you feel more present in your body is wonderful for anxiety. So any exercise whatsoever, the intentions there, start and just try and see where that takes you. Question, please explain the difference between bipolar disorder and schizophrenia. Please use real-life examples to explain the differences. Also, please detail how to look for mental illness in adults and children. Okay, a lot of questions there. Bipolar disorder and schizophrenia. Schizophrenia is largely an illness where the patient's out of touch with reality. So they can have psychotic symptoms. These are fixed false beliefs that are not in keeping with their culture. So, for example, if I'm a psychotic, if I'm a schizophrenic patient, I may believe that there are people out to get me, that there's someone who wants to kill you. And this may be very valid and in my head and very real, but to the people around me, they're like, no, there's no one there. And I would find, and it would be a fixed false belief. That means even if you tell me or show me that it's not true, you can't shake my belief in that. Now, in some cultures, there are things that are culturally appropriate. For example, in the African culture, they would say things like, I have angered my ancestors, and so my life won't be going well until I appease my ancestors. This is culturally appropriate. We would not consider this as someone who is schizophrenic. Bipolar disorder is someone who has mood disorder symptoms as well. So they would either experience depression, mania, or hypomania. They may have some psychotic symptoms in some types of bipolar, but not all. Schizophrenia is the psychosis is more prominent. Bipolar, I mentioned earlier what the patients look like, so I'm not going to go into that again, but they have marked differences or marked changes in their mood. They can be highly energetic or irritable or excessively happy, pressured speech, decreased need for sleep. This is different from a schizophrenic patient who may initially become very quiet and withdrawn, stop socializing, or become quite paranoid, or become aggressive because they believe that these psychotic symptoms. They become quite dysfunctional, the schizophrenic patients, because they're afraid to live their lives because these are their beliefs. They also may be responding to voices that they're hearing in their heads, and sometimes they may even see things that other people don't see. How to look for mental illness? I've mentioned a good few of the general symptoms that they may start with, and if those get to the point where they're creating functional impairment, people are no longer able to socialize like they used to, or take care of their responsibilities, or do their jobs, and then that's what you'll be looking for. In children, we often experience slightly different symptoms. So children don't always have the words to speak, to say what's happening to them. So they get excessive levels of irritability. We also get physical symptoms. So children will often complain of vague things like my stomach hurts, my head hurts, my legs don't work, or very childlike complaints. Okay, next question. You spoke about substance abuse is part of mental illness. Does it mean if I can't live without anxiety pills, is it considered to be substance abuse? Generally, we don't consider what has been prescribed by doctors as substance abuse. If you're using it more than it's been prescribed, or larger doses than it's being prescribed, then it's abuse, yes. If you are using more pills than you'd like and you feel it's time to cut down or to wean off, please don't go cold turkey. You will simply relapse. Go and see your doctor so that you can work out, the same doctor that's prescribing these pills, work out a regimen where you start to reduce and manage the withdrawal while you're still managing, where you still have the mental health to do it slowly and manageably. That's not considered substance abuse. What are Islamic rulings or views on self-harm? Now, my Islamic background is like most of you, I would think. I'm Muslim, but I have not done any training in terms of the Islamic, in terms of actual beyond madrasa learning, I would say. Obviously, self-harm is not allowed in Islam. It's makruh, and the level of self-harm could even be considered haram. However, if it is part of your mental illness, I would think that is something that is even bigger than the self-harm. Get help for your mental illness, and therefore then your ability to express your emotions would also be healthier. For most people who self-harm, and I'm not sure what you're referring to specifically here, whether you're talking about suicide, or you're talking about self-harm as in cutting or hitting your head against the wall or other forms of self-harm. For me, human life is sacrilege. That's something that is Allah given. What you do with that amanat, what you do with that body is also very important. So suicide, we know it's clear, it's haram, it's not allowed. But I have this idea that for someone to be in that space in their lives that they cannot see another way out, we don't know what that feels like. Unless you've been suicidal, standing with the gun in your hand or the pills in your hand, you don't know what that feels like. I don't think we should be judging. I think the test that has been imposed on them is far harder than most of us will ever understand. So for you to be suicidal, only you know what that feels like. Help is out there, get help. Self-harm in terms of cutting yourself, and a lot of people, maybe I should go a little bit into that because I think this is not something lay people know or understand very well. For some people, they don't feel emotions. They can feel quite dissociated or numbed out. And when you harm yourself, either by drawing blood or hurting yourself in some way, that keeps you, that's two things. One, you're in control of the situation. Two, the release of blood or that pain allows you to express something versus the nothing that you're expressing in your emotions. I don't know if this makes sense. So some people feel a sense of release. I talked about a panic attack being a sense of release. For some people, self-harm gives them a sense of release and a sense of control. It is obviously not healthy. Nobody advocates that. But I also feel if you're not in that position, don't criticize. Rather offer help and be objective and supportive as far as you can. How does someone who can't afford therapy can receive help? Well, most of our state facilities and clinics do have mental health clinics, so they would have a psychology department. The waiting lists are long. There are always places in our community that offer help, and probably a lot faster. So for example, SADEG or Lifeline, all of this you can Google quite easily. There are helplines. A lot of the companies offer helplines now. So Discovery's got a helpline. Islamic Care Line also gives you gives you telephonic counseling as well as in-person counseling. I'm sure there are many Jamiat services around the country. Wherever there are Jamiat offices, there are counseling services available as well. You just need to look. There are many, many other social service projects as well. At what stage Islamically should we start medication? I don't think this is really Islamically determined. There is no point at which here's when we should start medication for everybody else, and this is where Muslims should start medication. I think for me is if you're not coping with this on your own, go and get help. You do not need to see a psychiatrist first off. Go and see your GP. Maybe get a referral to a therapist, and a therapist would be adequately trained to make that assessment and suggest and talk you through it. Like I said, you're not obliged to do anything. You can go and see a psychiatrist and walk out of there and say, I'm not going to take anything from that script, but at least now I know what my options are. I know what's for what. I know what I can do. Perhaps maybe I have a plan B, but I can work on my plan A. How do you cope with early symptoms of mental illness? For example, sleep problems, fatigue, and anxiety. I feel it's not part of mental illness because it does go with the correct willpower. Yes, for some people it does. And not everything needs to be classified as a mental illness. Perhaps insomnia or sleep problems or fatigue or anxiety may be part and parcel of whatever else is going on in your life. Correct. So take care of yourself. Nabila gave a talk last week on self-care. Get yourself in a good sleep routine, practice sleep hygiene. Fatigue, Maybe go and see the doctor, go and get a vitamin B shot, start to sleep a bit more, start to rest a bit more, start to do a few more productive things. If you're not exercising, start gentle exercise. And in terms of anxiety, there are many self-help methods that does not need to be medicated. Okay, so there are lots of things. You know what? The one thing that I like about the COVID pandemic, it's forced us actually as a South African nation to go online. Things we were resisting prior to this, even us, we've never done online sessions. Suddenly I can see patients anyway, and patients can access help like a psychiatrist or a psychologist without having to leave their homes. Likewise, Google, YouTube, whatever it is that you want to go and look for, there's plenty of videos out there. There's plenty of self-help websites as well. How many symptoms does one need to be diagnosed with a mental illness? Each mental illness has a specific set criteria. Part and parcel of the criteria is there must be a distinct level of distress that the patient is experiencing, and there must be functional impairment. The patient comes to me and says, I am sad, but I'm not impaired in any way, I'm perfectly fine. I would find that very odd, but I cannot then diagnose a depression. So there aren't a specific number of symptoms. These symptoms, though, are available, or these clusters or diagnostic criteria are available online as well. There are far too many to go into. The two questions I would ask, is this creating functional impairment? Are you finding, in the same question, are you finding life is taking more effort than it used to and more effort than you're prepared to keep giving? Yes. And the second one, is it causing significant distress? And this may be for yourself and your family. Those are the two questions. If the answer is yes for either or, then I suggest you go and seek some kind of help. What is your advice if you're feeling suicidal but can't speak about it because it's haram? So you pray and make more dua, which doesn't help. Well, then you need to speak to someone who is trained to recognize these or to hold your feelings in that space. So if you're afraid of being told it's haram, I can tell you now there's no psychologist or psychiatrist in this country that's going to tell you that's haram, don't come and see me. We're not trained to do that. We're trained to hold the space for you and be objective. Even if in your mind, I'm a Muslim, I should be condemning that. That's not what we do. We're not trained for that. So go and get help. If needs be, find help in any space that you feel will not criticize you so that you can speak about it, because that's the first step for mental health, is to go and find that space, to go and seek help. Is it normal to have poor recollection of events or poor memory when on strong medication for depression and anxiety? Using the word strong medication, it's not normal to have poor recollection or poor memory. So memory and cognitive functioning, because that's what you're talking about here, can be a part of the original presenting symptom or the original presenting complaint. So if you have high levels of anxiety or depression, poor memory and poor attention is part and parcel of those syndromes. When we give you medication, by lifting the depression or by reducing the anxiety indirectly, your cognitive functioning should improve. You should find yourself more present, more able to remember, more able to pay attention as well. But if after a long period of time, the depression is lifted, the anxiety is settled, and you're still finding you're not remembering so well, or the attention is the problem, please do see your doctor. We don't want those side effects. And if it's causing them, for every patient, there are different side effects. There may not be any side effects, but some people are sensitive and have a lot of side effects. That doesn't mean you need to stop the medication. Go and see your doctor. I always find when patients are better, they tend to want to stop. And sometimes when they're better, I would like for them to start doing therapy or start enhancing their coping skills so we don't find ourselves back where we started in the first place. But if you're having side effects you can't manage, go and speak to your doctor. They will try and tweak your medication here or there or replace it with something else that will maintain you without giving you these same side effects. In recent years, there's been huge advancements in mental health care, and as a result, also in the psychiatric medications available. We now have medications that target the cognitive symptoms directly, so that are not going to cause problems in memory or attention, that are actually going to make those better. So go and see your doctor and discuss that and say that you attended a talk and there was talk about a medication that target the symptoms of memory and attention. How do you get around parents who don't believe in mental health or speaking to a mental health professional? That is the problem for adolescent patients because they are at the mercy of their parents. Difficult. I don't have any hard and fast answers. I can't tell you what's going to make things easier or get them around to believing. However, if you're an adult yourself, you do not need your parents' buy-in, right? You need to do what's right for you. Obviously, we all want our parents' blessings, but if your parents love you and trust that they've done a good enough job raising you, they will be able to withstand the differences you may present with. I always make shukr for my own parents, got a very different mindset some days. I wonder how they coped with me growing up, but they did, and here I am. And alhamdulillah, they're very loving, very supportive, even though they may not have always understood my choices. So I have no hard and fast rules, but if it's something that really bothers you, if you're a child or an adolescent, please do sit your parents on and tell them how much this means to you and what you think, what you feel. They may have some advice for you, or they may take you seriously if you sit them down and explain properly. Is it better to take herbal or conventional pharmaceuticals to treat depression? I'll answer the question in herbal. I don't know what conventional pharmaceuticals is because all of our medications fall into that bracket anyway. I would much rather prescribe something I know and am familiar with. A lot of the herbal medications out there contain things that are not on the bottle. They've not been subjected to the rigorous training and testing that is done by the FDA or our South African's Pharmaceutical Council. So when you're taking something from the auntie on the street or that lady down the road that sells that nice product, you have no idea what some of those side effects can be. And I've seen some horrible side effects in my life. I'm not condemning all herbal medications. I'm saying some herbal medications can have some horrible side effects. If you are on psychiatric medication, you want to try something herbal, take that product in to your doctor or to your GP and ask. I often tell my clients, I'm not saying don't, I'm saying bring it to me because I do have a medical background. And if I don't have, if I'm not familiar, I'll Google it to make sure that I know what it is. And if there's stimulants in there, those are not good for anxiety. I'll give you a small example. I want to ask by a show of hands because I won't be able to see who's raising their hands. How many of you drink green tea? Herbal, right? Over the counter, right? We go to Discount or to Clicks or to Pick and Pay and we buy herbal tea or green tea off the shelf. Great, right? Who hasn't told you green tea is amazing for energy and for weight loss? Well, let me tell you something. When you're suffering from anxiety, having 10 times the amount of caffeine that is in your normal tea bag is not good for your anxiety. Okay? So this is the kind of chat you should be having with your doctor. I want to have this or I want to have that. I'm not going to product name and shame, but I would much rather have something that has been tried and tested, that comes with a package insert, that is sold by someone, or rather, can I say, that's prescribed by someone that has no interest in the bottom line. When I prescribe a medication, I sometimes don't know how much it costs and I don't get a cent from that company. The auntie who's selling you that product is making a living out of it. She's going to want to sell it to you. So be very careful. If you are on psychiatric medication, be very careful. Having said that, a lot of our conventional pharmaceuticals, as you call it, actually have their basis in herbal beginnings, if I'm going to call it that. The first few antidepressants were based around St. John's wort. So for those of you wanting to go and get St. John's wort, yes, but it's also very basic. Right? So you need to have the right amounts. A lot of people tell you go and have melatonin. A large amount of the melatonin you're going to pick up over the counter. Alhamdulillah, melatonin is no longer available over the counter because it was abused. But if you're going to pick up melatonin, it isn't available in sufficient enough doses to be effective. So if you're going to spend 400 Rand on something herbal, I'd much rather go and see the doctor and spend 200 on something that I know is going to work. Right? So just be very careful there about thinking that everything herbal is safe for you. I'm a single working mother with 2 kids. I'm going back to work since COVID. I'm so stressed out with going back, anxious about post-COVID stress or anxiety. How do I deal with this anxiety? I went to the office once to collect a printer. I had such a shock when I went on the road. Panic attack, had to pull off to get a grip, now fearing that this will happen again. And I think the key thing here is to plan ahead. You know you're going back to work. You know you're going to have to drive down that road. So don't make a big thing out of it because the day you're going to go back, it's going to be a huge thing. Speak to your boss. Can you do on-site maybe twice a week now? When take a slow drive one day when you're not stressed out, get to the parking lot, and the first day maybe just sit in the parking lot. The second day, get yourself into the building and even have a cup of coffee at your old desk. The third time you go in, actually do an hour's worth of work and slowly ease yourself into it. If you know that this is going to be difficult for you, prepare yourself for it. You can have progressive exposure before getting to the big thing that will be causing the stress. How does one cope with anxiety, like apart from tablets? Actually, tablets are not your first port of call for anxiety. We look at a lot of other methods to decrease anxiety, and I'd suggest you see a therapist to speak about skills like cognitive behavior therapy. If you've experienced trauma, perhaps you can look at brain working recursive therapy, which is BWRT. You're having mood dysregulation, you're unable to regulate your mood as much as you'd like. So there are many therapy methods that you can use. You can also use just grounding, meditation, being aware of where you're at, being aware of the symptoms, talking yourself down from them. So there's lots of methods you can use. You do not need to be on medication. Those fail, then I suggest you can see a doctor. Or if you start to do those things and they bring on your therapy, like I mentioned to the previous lady, she gets into the car and she feels anxiety levels rising. She may need a bit of help to keep her calm so that she's able to access those stages of stress. And that would be the same thing I'd advise for you. As a coach, what are key points for me to identify in a client that I need to refer them to a psychologist? First and foremost, if there's anything biological, and by this I mean your bipolar, your major depressive disorder, so the sadness, the psychotic symptoms, if there's substance abuse on board, if there's obsessive compulsive disorder, I'm seeing quite a bit of that now with COVID. If there's panic attacks, I would suggest that you perhaps refer them to see a psychologist. So as a coach, you're in the perfect position to screen. And there are very nice screening tools online that you can sort of administer as part of your intake form before you do the coaching session. And I suppose you do a lot of these questions already. You just need to pick up where the red flags are and then suggest that maybe someone see a psychologist or someone qualified to actually diagnose these illnesses. But you are in the perfect position for that. They're asking to share the slides, which I will. How much does an unstable upbringing, for example, parents constantly arguing, influence mental illness or health in adulthood? It does, but it does not need to determine the path of your life. Many patients have a genetic predisposition, so they've got mothers, grandmothers, fathers, uncles, aunties who have had mental illness. So in mental health, we call expression of mental illness a two-hit approach. The one hit is having a genetic predisposition. So you're already higher risk of getting mental illness than anybody else. And then the second hit is generally something that happens during your lifetime. So either a traumatic childhood or a big life-changing event like losing a loved one, and that can push you over into expressing a mental illness. Now, a lot of people have risk for mental illness, but never express it. And how do they not express it? How do they reduce their risk? By being resilient. Okay, so by being flexible. There's something that COVID has taught us, and I'm sure a lot of you are going to tell me this. How many of you have found how flexible and resilient you are, who are actually thriving, who are thinking COVID is the best thing that ever happened because it's pushed me into directions that I wouldn't have looked for myself, but now that I'm there, I'm doing perfectly fine. In fact, I'm doing better than most people around me. There are a lot of people who are doing better than they were before. When you ask them, we explore why, sorry, we're finding that they're quite resilient. And I can't give you an exact definition for resilience, but resilience is having stability in your character that actually allows you to be flexible with changes that life gives you, that is able to pull through no matter what the situation comes. And actually having parents constantly arguing in your childhood, you may use that as motivation to not have that repeated in your life. You may want to break the cycle. So for some people, they cannot withstand and they become their parents. So they grow up having the same kind of broken, vicious cycle that they pass on to their children. A lot of people, they do things differently and you ask them and they go, I grew up with that. I don't ever want to do that to my kids. So I'm going to seek help so that I can find out what my alternatives are instead of arguing or bringing it to my kids, making my problems their problems. And I'm going to break the cycle because I owe it to myself. I've had a crappy childhood maybe, and I owe it to myself to have a better life as an adult now that I'm in control and perhaps give a better life to my children. So instead of using it as a reason to not be okay, use it as a reason to be better. The next question. Hi, I was diagnosed with bipolar 2 years ago. I found that support groups helped me the most besides medication. Do you know of any good support groups except the major ones? You know, previously, like I said, things were very limited. You could only look for things in your area because a lot of this needed to be face-to-face. And I find with COVID, online has made everything accessible to us. You can belong to a group in Canada. You can belong to a group in India. If this is what feels like home for you, why not? I don't have any specific groups to refer you to, but there are lots of groups on Facebook and there are lots of other groups as well. I would suggest you check out a few, join a few and see what feels right for you and go for it. And perhaps you can let us know what's worked for you and refer to people around you as well. How do you respond? Sorry, I lost the question. Sorry, I'm just trying to find I've received so many questions here. I'm sort of sliding through them. If I can, here we go. How do you respond to a loved one who is suffering from anxiety? How do you help them in a moment? Thank you for a brilliant question. And I hope that by you asking, you're going to help what I call the Make Sabar Brigade, because that is not a useful thing to tell someone. Simply sit with them, be present, don't give advice, don't tell them what to do. Ask them what they feel, ask them what they would like from you. Sometimes it's as simple as just sit here, don't talk, or just sit here and listen to me. Sometimes it's that. It's nice to get them in the moment. So for people who suffer from anxiety, they're usually stuck in their thoughts and they're stuck in this vicious cycle. And you can get them to sort of get out of or be unstuck from that. So I often tell my clients, when I see them going all over, I go, no problem. When I see that they've sort of run out of a little bit of energy, they've done all the talking, I let them do a bit of talking. They usually run out after a few minutes. Now I'll go, if you just close your eyes. What do you hear? What do you smell? What do you taste? What do you feel? And I will actually talk them through the feeling. And it can be as simple as, how does your back feel against your chair? How do your legs feel against the bottom of your chair? Put your feet on the ground. And if I see my patients wearing shoes that they can take off, I'll actually ask them, take off your shoes. Feel what the carpet feels like underneath your feet. It's just this act of grounding someone in the here and now that makes that adrenergic response start to calm down. You may even do breathing techniques. You can Google these. So a common, easy one to do is breathe in for 4, hold for 4, breathe out for 4, keep it out for 4. So it's 3, 4, hold in for 2, 3, 4, out for 2, 3, 4, and so on. Just to get them to be out of that vicious cycle in their head, right? And then make them a cup of tea. Simple, but ask someone what they would like. But these are some common techniques that you can use. How do I know if it's bipolar or it's just depression? Frequently, depression presents, so with, I call it unipolar depression, so major depressive disorder and sometimes bipolar, both will present with depression first. With depression, patients will come out of a depression and they should feel euthymic. Euthymic is a normal range of mood. With bipolar, sometimes they have a manic or a hypomanic episode, which is this high or this highly irritable space. This can last for a few days, and this is usually followed by a downer, which is a depressive episode, and then they may be having sort of normal moods in between, but there's usually a distinct up mood or a high mood. So that's what would tell us that the patient is bipolar and not just depression. We often find out the wrong way. So we will start a patient on an antidepressant, and an antidepressant pushes the patient in one direction only, that is up. Now, the patient who's got bipolar, by definition, they need a mood stabilizer which pushes both from the top and from below. So we try and get them into the space that I talked about, that euthymic. So mood stabilizer does both. An antidepressant only pushes this way. So if you're presenting for the first time with depression and your doctor puts you on an antidepressant, they may actually stimulate a manic or a hypomanic episode. And sometimes that's how we diagnose bipolar. But if you're not sure, chat to your doctor about your symptoms. Also, there are online tools to check if you're having a manic or a hypomanic episode. I often give them to my patients because they're not very clear when they report the symptoms to me, and we'll sort of do a tick list in the office. We'll get the symptoms and decide whether it's for or against. How do you attempt to reason with an individual and their family who are blaming you for their recently diagnosed bipolar disorder? What are the chances of bipolar disorder being a misdiagnosis? Well, nobody can blame you for being diagnosed with a disorder. Even if your relationship with this person is creating a lot of stress, you cannot make someone have a bipolar disorder. They have an underlying predisposition to it, and perhaps life stressors have unmasked it or allowed it to be expressed. That doesn't mean you've given them bipolar. So that's the first thing. What are the chances of bipolar disorder being misdiagnosed? Not very high. But then on the other hand, if I have a patient presenting with what looks like bipolar, I always give them the benefit of the doubt. When they've stabilized and they've been stable for 4 to 6 months, I do attempt to wean off the first time. So we'll attempt to wean off, and if they wean off successfully, then we can say that that was a bipolar episode, not necessarily a bipolar disorder for life. And it often happens that postpartum or after pregnancy, patients have highly at risk of developing a bipolar episode or a manic or hypomanic episode. And often they don't need medication for the rest of the time. It's just that they're at high risk during those periods. So there is a possibility that it's misdiagnosed. In private practice, because medical aids don't fund a lot of our conditions, it's very hard to access benefits, and medication and visits to the doctor are very expensive. A lot of private psychiatrists have a tendency to diagnose bipolar more because it's a prescribed minimum benefit condition, which means your medical aid is obliged to pay for it. So am I seeing more bipolar than there actually is? Yes, right? If you're not sure about the person's diagnosis or they're not convinced, that's best discussed with their psychiatrist. In terms of you being blamed, I would actually talk through this with them. And if they feel that they would like to move past this, ask if you can attend a session with their psychologist with them, or perhaps even attend your own session. I don't know what your relationship is with the family member here, but if it's your spouse, ask if you can go for couples counseling so you can talk this through, or ask if you can go for one-on-one if it's a parent and a child. You can go for an individual counseling with that person present so you can talk things through. If it's someone worthwhile in your life, it's worthwhile sorting out the relationship. Is there any way I can get mental help for my child? I'm a single mom, lost my income. Yes, most of the bigger hospitals do have a child psychiatry unit or a child psychology unit. You can approach them directly, approach the child clinic or child clinic and ask them if there's a psychologist present that can assess your child. If there's a psychologist attached to your school, and there usually is, the school may even be able to fund, if you speak to them about your financial situation, the school may be able to fund the assessment as well. These are usually cheaper than seeing someone in private. Please give more information about schizophrenia. Schizophrenia is where someone's got a fixed false belief that is not in keeping with their culture. And they usually have an impairment in functioning, and they have some level of distress. The symptoms need to be there for longer than 6 months for a diagnosis of schizophrenia to be made. Schizophrenia is actually a genetic condition, so that you'll find there's often a positive family history of schizophrenia, and it's usually unmasked by big life events. So if they're using substances, that's not a big life event, but if they're using substances, they're at higher risk of developing schizophrenia or unmasking a schizophrenia. Don't misunderstand and feel that the substance is causing the schizophrenia. A substance can cause psychosis, but it usually goes away when the substance is stopped. With schizophrenia, it unmasks it and the psychosis stays. It can also be higher risk of developing during adolescence, because this is a period of very high growth for your brain. So when your brain expands very quickly, you can develop onset of schizophrenia. Okay, just trying to find the next question. I may have come to the last of my questions. Let me just see that. Nope. No. Okay. Can CBD oil or products be used in Islam? Islamically, it's highly disliked if you're using something that's mind-altering. Right? So anything that can change your mental state for something that is false or not is not sustainable, or so if you're taking something to be intoxicated, for example, then it's not allowed, right? So CBD oil or products. So there's a lot of talk about what contains THC or tetrahydrocannabis, and that would be intoxicating. And then there's some products they say that don't have the what do they call it? The part that is they have a certain word for it, where it doesn't work in your brain. My question then is, then how does it work? Because if it's making you calm and it's making you sleep, it is working in your brain. So be very clear on what you're using. I don't think there's anything wrong with using something that just takes the edge off, but it must not be to the point that you're relying on that thing, that you cannot do without it, and that you're becoming addicted to it. Right? So anything that is increasing your tolerance levels for it, which means, so I was using 1 drop of cannabis oil to sleep, but now I'm finding I have to use 2 or 3 drops. That's creating tolerance. That is something that is causing addiction in your brain. So be very wary. Anything that you're using for the wrong intention, I would be hesitant to use. If it's something that you're using with a slight idea that I'm just going to use it for a while to get over the bad patch in my life or through this very stressful time, I won't be judging you on that. What are some coping mechanisms when experiencing episodes of anxiety? We spoke a bit about that. So we spoke about types of therapy you can use. We spoke about self-help, meditation, grounding techniques, breathing techniques. And we also spoke about the different types of therapy. My daughter is a teenager. Sorry, I'm moving on from that question. My daughter is a teenager and seeing a psychologist. I need to understand why we're not informed of what can trigger this so that we can make changes. So 2 things. Your daughter may be a teenager and therefore be considered a minor. In psychology and psychiatry, we actually take your daughter's rights or any adolescent's rights very seriously. So it's important for her psychologist or psychiatrist to maintain that space as being her space, not the family space. And I'm going to be blunt, your needs are not first priority. Her needs and her trust are going to be first priority. If, however, you are saying you want to help her so that you can help be better supportive of her, express that to the therapist or the psychologist so that they can then get her consent to perhaps hold a family session or two. Even if it's not with the same therapist, you may want to explore that. But I often ask my parents to come and meet me, and I'll explain beforehand to my client that we would like your family here so that we can't fix this in isolation. I can't tell you what we need to do or get you better, or the home situation, they're not getting you. So we often ask the parents, and they have questions, understandably so. I'm a mom as well. I would like to be involved in my child's care, but understand the fine line between loving, caring, nurturing mom who wants to make things better and a mom who's going to come in there and wants to complain to the psychologist or psychiatrist about their child and perhaps jeopardize that space. So just to be aware, for me, if I see an adolescent, that child's mental health is my priority. I don't need to appease anybody else. I would like to because I see the importance of it, but her being comfortable with that is of paramount importance to me. As parents, how do we deal with moods and attitudes and rudeness? We also get hurt by these words. Absolutely. Just because someone has got a mental illness does not mean they're allowed to hurt you. So I would be very clear on that. This is also very important. Nabila discussed last week about boundaries. Maintain your boundaries. Your child can have anxiety, your husband may have depression, but hurting your feelings is not okay. So perhaps in that moment, you do not need to respond or to react to that anger or to whatever offensive behavior is. You do not need to add to the situation by reacting. Take a moment, pause. When that person's calm, come back and say, what you said or did hurt my feelings, and that's not okay. Because that also means you're standing up for yourself so that you don't end up in the same space and adding to the problem. In terms of moods, attitudes, and rudeness, I think a lot of flexibility is necessary. So to understand my child's going through some things, maybe I need to be a bit more flexible. Maybe the rules don't have to count all of the time. But then in your head, have a boundary, draw a line and say that's not going to be acceptable. I also think children and adolescents sometimes take liberties. They want to experiment. They want to know how far they can get away with stuff. That's their nature. That's actually their job, is to figure out what their own identities are. So they'll push your boundaries. Your job is to actually create a bit of stability and give them boundaries back so that they know how far I can get away with. How far can I push my mom before she'll say no? And I find when you're very clear with the kids on what the rules are, they appreciate it because they know what the boundaries are. It actually makes them feel safe and contained. I often find, even though I may have a prearranged agenda in my head of what's acceptable for my kids, I find just talking to them, saying, if you do this the next time, what should the outcome be? What do you think is an appropriate consequence of your behavior? I don't use the word punishment. What do you think is an appropriate consequence for your behavior? Now, often they'll come back with stuff that I wouldn't have even thought of, that are actually worse than what I was going to do. So if they say, the next time I do this, you're allowed to do that, I will go, okay, so you understand that this is something that's not okay. So, but never do it when they're emotional or when you're emotional. I know that's not always easy. How does Islamic psychology or psychologists be different than normal psychology in terms of content or treatment? What's the main difference? An Islamic psychologist uses Islam. There's not a purely objective perspective in the sense that they're not going to sit there and not take religion into account. They're going to nurture you or push you from an Islamic point of view. My exposure to Islamic psychology has been very recent, and I've been very fascinated because I've realized that it's not a new concept. In fact, mental health in Islam goes back to the Quran and to the Hadith. But these will be used in your therapy session or in your psychiatric space to help push you to find yourself in a better space for you, but use religion for you, help you find a better balance. Whereas other therapies do not, they try to remain objective and don't affiliate with any religion or ideology or belief. So that's the main difference. I don't know if I can be clearer than that. They're not. We don't recognize, so Islamic psychology is not a qualification that's offered locally in South Africa, though I think you could have an Islamic background, a strong theology background, or a degree in Islamic studies, and then you could do psychology. I know it's being offered by overseas universities or colleges as diplomas and full-on degrees, And I think this is something that we're going to see a lot more of with COVID. Our world's becoming smaller. I often attend talks or seminars from universities overseas, which is very interesting for me because we don't have a lot of that here in South Africa. We're a very small population, actually. So the next question, I was diagnosed with depression, OCD, and bipolar in 2019. I was in meds, but took myself off it as it makes me feel heavy drugged. I have not gotten any coping skills, and private is pricey sometimes. Where are you situated? What are the costs? Really interested in coming to a session with you. Jazakallah khair for the trust in me. I am in Johannesburg, very easily available on Google if you'd like. My practice details are available online. However, I'm going to tell you now, if you want to get coping skills and you want to avoid medication, not that I don't want you to see a psychiatrist. I feel your best bet is to see a psychologist because that is what they're trained at. And there's some very good psychologists out there. Medication does not necessarily need to be the first option. In terms of being on medication, I don't like patients coming in telling me they're drugged or they feel drugged. We move away from that as fast as we can. Okay, so you need to find a doctor who's not happy to just keep adding to your script. And I think the younger, newer generation of doctors are there. We're not very happy with you leaving our premises with a script or 2 pages of script. It doesn't work like that anymore. Thank you for the balanced presentation. Please explain narcissism. That's a whole presentation in itself. In brief, a narcissist is someone who thinks they're better than others, who cannot see it from another person's point of view, whose whole interaction with people is based on trying to get their way and trying to make you see it from their point of view. If they don't, they'll do 2 things. They'll boss you around, and if they can't boss you around, they play the victim. Narcissistic relationships or narcissistic people are quite common out there. Not everybody recognizes it as narcissism. I'm not going to go into a lot more explanation. What I'm going to tell you, if you think you're a narcissist or find yourself living with a narcissist, Google the gray rock method. Because when you do not give the narcissist what they need, which is a constant need for drama, when you do not give into that drama, they get bored with you. And that's what the gray rock method is. It teaches you how to cope with someone who's narcissistic and that is in your life. So Google that, gray rock method. I'm trying to get through some of these questions. Assalam, I've had a series of anxiety attacks in the past few months after the birth of my son 6 months ago. I went through postnatal depression. I did not seek help as I tried to make it go away. I recently visited my gynae. He prescribed medication for me, which I did not start yet as I feel that I'm better now. I just tend to have an episode every now and then where I feel guilty for missing out the first 2 months of his life by not giving him the love I'm supposed to. And it's difficult for my daughter. She's 1 year and 8 months and my son is 6 months. So I'm trying to be the best mom, stresses me out as I want to be a good mother to both of them because they're both babies. I'm afraid too that I might get hooked onto the medication. Also, for the past 2 weeks, I've been taking painkillers daily because I've been experiencing these migraines. Okay. So migraines, obviously you want to medicate that. Let's start from the back part of your message, which is the migraines. You're not feeling okay, but what's causing these migraines? Could be hormonal, could be chemical, could be stress related. It's stress related, and I'm hearing what you're saying here in terms of having a postnatal depression that your gynae picked up months later, right? That your gynae picked up months later and in fact felt stressed out enough about it to prescribe something for you, but you've resisted. You can't get back your son's first 2 months. But what I'm going to advise you, you don't want to go back there. You want to give him the best you can give him from now on. And maybe you need to talk that through. Sometimes you don't need medication. Sometimes you need to talk. And just being in a space where you're not judged, where you may be allowed to go with your baby. There are mom-baby support groups. There are some online as well where you can log on to a group or connect to a group with your baby in the room. A lot of these support groups actually want to see you with your baby. And a lot of them are not expensive as well. You kind of want to move past how traumatic this first few months have been for you. And possibly your child doesn't remember it that much, I can tell you. From a biological point of view, your child is not going to remember it. This is not going to affect him in the longer term. However, because it means so much for you, seek help, try to move past that. In terms of your migraine, just try and figure out if it's because the stress is ongoing or because of something else. If it's ongoing and you think it's because of stress, I suggest perhaps you do start the medication your gynae gave. What do you have to lose? You could visit your gynae again and you can talk through the symptoms again. Okay, my God, I'm going to try and tell me. I've got 4 more slides of questions. Are we good to go in terms of time, Masfiya?
Assalamu alaikum, Feroza. It's Masoudia. How are you?
Alhamdulillah. How good are we for time? How long are we going to go on for?
I really it's really up to you. If you want to continue, I mean, whoever needs to leave can leave, and they can just follow the YouTube on a later stage. If you want to stop, you can stop. It's really, if you want to answer, it's really up to you.
I'm good to go. I'm good to go. So I'll go. I don't have a lot more questions. Let me see how I go. A lot of these are being repeated, so I'm going to skip through those if I've already answered it. But let me go through this.
So Feroza, there is quite a lot of other questions that people send. So I think the questions that you've got now, I think we'll stop halfway through those questions. But there is quite a lot of questions that won't be answered because there is a lot of questions. So besides the ones that you currently have, so we'll take it from there, inshallah. Shukran so much. Maybe you can stop at 9 p.m.
I think so. I think we stop at 9, and I'm hoping we get through most of this as well. But then maybe this is an indication, and I know that Masood's got, for those of you still listening, Masood's got a wonderful lineup planned. I'm focusing on mental health. So inshallah, if I don't get to answer all of your questions, some of the other speakers will do so. But then I'm happy to schedule another chat. Masood, you just let me know. Let me see how many more I can get through before the end.
Shukran so much. Salaam
alaikum. Salam. How does nutrition fit into all of this? You know the saying, we are what we eat. If you're not taking care of yourself, there's half the problem right there. And I've already mentioned that when we have a trauma response, we have a hyperadrenergic surge. So our bodies go into a state of hyperadrenaline, which means we're not feeling hungry, because you must remember, during that state of hyperadrenaline, our bodies are focused on survival. And it looks at all the body functions that are necessary for survival. So it's not going to look at hunger or sex or sleep. It's in fact going to make you not sleep, not feel hungry, don't have a libido. It's going to slow down your metabolism and your digestion, right? So for those of you already in a hyperadrenergic state, either through depression or through pure anxiety, you're not going to be hungry. If you eat, it's because it's giving you a psychological, emotional binge eating episode. I mean, how many of you will tell me, I don't eat food, but as soon as I'm sitting in front of the TV, then I'm having a whole bag of crisps, or I can eat a whole McDonald's, or whatever it is. But binge eating is very common. Start to feed your body the right things. Because what you're eating, if you're not eating healthy, you're becoming sluggish, you're aggravating the symptoms that I spoke about. So you're just lowering your metabolism even further. You're not having optimal brain food. Brain food is raw food, salads, vegetables. If you want your food cooked, but feed it unprocessed. Cut out the burgers, have a piece of meat if you want, but keep it clean. Don't put too many sauces on it. Eat healthy. Nutrition is important. There's a huge segment or a huge part of psychiatry that's now looking at the human biome. They're looking at your gut as being a whole organ system in itself. And they're looking at the relationship between your gut and your mental health. That what we eat affects our mental health, and our mental health affects what we eat. Sort of like the chicken and the egg. Which came first? Not clear. But if you start taking care of your nutrition, eating healthy, smaller, regular meals, versus I don't eat for hours because I'm not hungry, and then suddenly I have a whole plate full of stuff, and then I'm cramming my mouth full of crap, you know that's not healthy. So if your mind is telling you, logic is telling you that's not healthy, you're not making things better. Even if it seems to you like it's not making a difference, I can promise you a little bit of healthier food, a little bit more physical exercise, and better sleep. In life, sometimes you just got to take it back to the basics. You're eating properly, sleeping properly, being a bit more physically active. Back to the basics that can make a world of difference for you. How do you deal with a bipolar husband? I feel he drains me. A little bit of a joke. Does he need to be bipolar? Sorry. I don't have any correct answers for you here. Right? He needs to be compliant. He needs to be on medication, and he needs to be stable. Other than that, it's really difficult to control his illness. He needs to do that. You can only provide a supportive environment, and you need to know what your limits are. How far can I support him without it becoming a problem for me? When am I going to, how much of a toll is it taking on my mental and emotional health, right? So just something to consider. Where are my boundaries? How much of this is my responsibility? Yes, he's your loved one. But when do you take time out to self-care so that you're able to continue being his wife and the mother, perhaps, of the children that you have? When do you continue to provide in all the roles that you have? The only way you can be supportive and provide the best in your roles is to take care of yourself. And that must always be first and foremost. I'm not saying neglecting or telling him to go to hell. I'm saying take care of your own needs And that may give you the energy and mental courage to help him take care of his needs when he needs you. And there are going to be times where he needs you. How does one support a loved adult son who has PTSD? He is resistant to take help. It's a difficult one. Perhaps discuss some of the myths that he has or the misconceptions that he has. Is that what is a stranger going to tell me? You know, I always feel sometimes when you talk about something or put it down in black and white, write it down if you don't want to speak to someone, write it down, but take it out of your head. It suddenly gives it size and shape, and it's no longer as scary, because when it's in your head, you cannot manage the proportions. It seems huge. When you write it down black and white, all your thoughts, fears, and feelings, it looks more manageable. I won't say it takes the size of a piece of paper, but it suddenly looks like something you can deal with. Perhaps his method of help does not need to be a psychologist. If there's a loved one that he likes to talk to, perhaps he's got a friend that he likes to talk to, or an imam that he trusts. You know, you guys can sort of mediate that he sits down and just talks about what happened without being told what he should have done, what he shouldn't have done, and how he must get over it or how he must make sabr. Sometimes you just need to let him talk his worst fears. And that I cannot stress the importance of just listening. I'm suffering mentally and emotionally, and I honestly don't know how to help myself, recently divorced and unemployed. Okay, so I'm hoping because you accessed this talk this evening that you have access to online. Go and look online. There's a lot of things you can do, and a lot of free services out there that can help you through this difficult time, particularly with the divorce. With the unemployment, as you're starting to feel confident, you can start looking for a job, but the divorce is a trauma you're going to need to process. There are lots of support groups, people like you. Access it. Being with people who understand you will make all the difference. My mother, brother, and sister committed suicide. Will I end up doing the same? My condolences to you, because that must be the hardest thing to look through. I think anybody who's not been suicidal or lived having someone close to them commit suicide, you will never understand that. You do not need to end up being another stat. You do not need to end up doing the same thing. I talked earlier about people experiencing traumatic childhoods. You can make your life different. In fact, you can use what happened to you as the motivation to be different. There may be, and if it's genetic, perhaps you may have a genetic risk, whatever it is they experienced. Be on the lookout, be proactive with your mental health. Make sure you go and talk out whatever's going on with you, and just equip yourself mentally so that you're resilient and don't find yourself in the same space. I can't say more than that. What would be the best way to counsel a family member with depression? What encouraging words could you say? Well, you've heard a whole talk where I've said to you that no one is exempt. And no one has been specially spared from depression or sorrow or grief. Sit. Perhaps words are not necessary, but sit. You do need to give words, encouraging things like, that must be so hard. Acknowledge the pain. This is so painful. What you're saying sounds like you're so frustrated. And then clear out, ask, how can I help you? If it's not someone that you're living with, would it be okay if I sent you a message every day? You don't have to reply, but can I send you a message every day? Would you like to meet up with me to have coffee once a week? And then at that coffee session, just try and keep your own stuff at bay and listen to what's being said. It's difficult, and if you can recommend that they get help, if they're not already getting help, that's the next step you're going to push them in. How to deal with panic disorder and fear of death. They are very remarkable. So panic disorder is very extreme, right? When you feel it, you will never forget what panic feels like or a panic attack feels like if you've experienced one. You know, that day before you're writing the exam or 10 minutes before the exam when you realize you've left out a huge section, that a panic attack is like 10 times worse, like on steroids. When you're having a panic disorder, that can be very debilitating, and you'll feel the effects of it for days to come if you've had a panic attack. But phobias are very easily treatable. Google brain working recursive therapy or BWRT. Look for a practitioner in your area. They will be able to help you with both the panic disorder, the original trigger or trauma, and also your fear of death. I've mentioned my contact details. I don't want this to be considered advertising for my practice. I'm actually at the moment at capacity, so I don't have space, but there are many people online that should be able to help you. My partner passed away due to COVID in July, and since then I have been numb and looking for crutches to prevent me from feeling the pain. What can I do instead of numbing? You need to go there. Numbing means I'm zoned out. I'm pretending this didn't happen to me. I'm not talking about it. I'm carrying on. I'm surviving. I'm taking it step by step, day by day, and I'm not going there. In order to move past this, you need to go there. You need to grieve. You need to go for grief counseling. I've mentioned BWRT. I know I'm sounding like an advertisement for it, but it's a very effective, very quick method to help you to go to places in your head that you're afraid of going to. But a therapist generally would be able to assist with the numbing sensation after trauma has happened. There's another question about getting help. Again, if you're unable to assist a family member in getting help that they need, perhaps schedule a joint session, or even schedule it as your own session, that I'm going for help, I'd like you to come with me. And then when you're in a session, talk about where the dynamic of that relationship is affecting you, and hopefully just hearing that perspective with a professional in the room may make the difference for the person you're going with. And this specifically refers to the question for the lady who says, my husband needs help. My dad has severe depression. His meds were just starting to work. In fact, sorry, let me go back to the previous question. Sorry. My husband currently needs help with his depression. I picked up on it. We need to get help since he is starting to doubt our marriage as a result, and I'm currently pregnant. Afraid it might lead to hasty decisions from his side. I think, like I said, maybe perhaps go and book a session for yourself. Go for the one session, talk things through what might be the best approach, and then ask him to join you in your session. Unfortunately, you can't make someone seek help or see that they need help if they don't want to. You can talk, you can support, but at some point you've got to pull back and take care of yourself. Right? But there are methods to make it easier, and I suggest you get professional help for that. I'll move on to the next question. My dad has severe depression. His meds were just starting to work, but made him feel ill. He stopped his meds now. He's totally regressing. How to get him back on meds? He doesn't want meds. He doesn't want to speak to anyone, taking a toll on the family. Well, then you convince him that he's just taken the first medication. I don't have one of my textbooks here, but if I could show you my textbooks, I often tell my patients, if I started you on one, that's how many more I've got to give you, right? And I don't feel, I'm not saying I'm going to put you on all of them, but there's a lot more options. Whatever was making him feel ill, he can go and discuss with the doctor. The doctor can either re-look at the dosage, take it a bit slow, or look at another option completely. There are always options. My 8-year-old son lost his dad. He says he wants to commit suicide. What do I do? You take it very seriously. When a child says they want to commit suicide, it's a very serious thing. Okay. So get a child psychologist or a therapist or an educational psychologist. Find out from the school if they offer therapy. This is something that needs to be taken fairly seriously to avert the last thing you want a lover but is for your 8-year-old to hurt himself. Right? So get him the help that he needs. He's grieving, and this is how he's grieving. So meet him at his level and take him seriously. If he's telling you that, I wouldn't hesitate in getting help very fast. Jazakallah for this talk. How can we best assist and support our friends who are dealing with psychiatric disorders plus drug abuse without judging? A hard one, but not judging, isn't it? No, I'm not sure what they're having the psychiatric disorders because of drug abuse or drug abuse separately. Listen, nudge. There's this great process called motivational interviewing that we use. We often get patients come and see us because they're not fine, but in the process, we realize they're self-medicating with something, either with cannabis or alcohol or something, and we kind of just nudge them gradually. We never turn our backs on them. We never tell them, don't come and see me till you're off. We offer help and ask them to come back and see us, but each time we ask them, what do you think this is affecting? How do you think your use of this thing is aggravating that thing? Certainly not helping. We kind of push them in that direction. I easily lose my temper. How do I deal with it? Find out what your triggers are, your stressors. Perhaps that's your way of dealing with stress. Definitely not okay. Go to therapy, learn with other ways of dealing with your anxiety or your stress. What would you advise women who go through depression due to abuse or GBV? Gender-based violence. Masbia, are we done? Sorry.
Okay, last one. We are going to stop just after this.
Okay. There's someone who asked me to contact them privately. I'm just going to say I don't do that. I won't be able to do that. I suggest they contact one of the helplines that I've mentioned already. I'm just going to go back through this one. What advice would you give women who go through depression due to abuse in the home, I would assume, and that abuse is not acceptable under any circumstances? Right, so this is something that I do feel you can approach community-based organizations or your Imam or other organizations in the community. You do not need to go through this. You will continue to go through the abuse as long as you don't speak up for yourself, and you will continue to have depression if you're going through the abuse. I understand it's not as easy as that. Most women don't have the facility to just up and leave. But then I suggest you start thinking about that. Can I accept being abused for the rest of my life? That's the only condition under which I will stay. Or if I can't accept this, then what's the plan? Where to from here? Start to think for yourself. It's also not okay for your children to see you living and accepting this as being normal, because they then go on to be abused in their marriages and think that this is just the way life is. Please don't do that to your children. Asfi, I think I'm done.
Sure, subhanallah, like we can literally have like a session on every single question that was asked, and I think that we will. So we hope to plan something a bit more structured for next year, inshallah. So our viewers know that we will sit and put together something that's a bit more structured and can cover a lot more things, and hopefully be more supportive and provide that space that many people need. But I hope that through tonight's session, people will take mental health seriously, or more seriously, and that they will seek the help that they need and encourage their loved ones to seek the help that they need as well. So I really would love to just thank you for taking out the time to share your expertise with us and to answer all of those questions. We really appreciate it, and we really look forward to working with you and hearing more from you. So Jazakallah khairan, may Allah reward you and protect you and your family and increase you in every form of goodness. Ameen.
Ameen to your duas, and Jazakallah for having me. Looking forward to being with you guys again.
Inshallah. Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum salam wa rahmatullahi wa barakatuh.